Question number 21. The yoke muscle for right superior rectus is option A, left superior oblique, option B, left inferior oblique, option C, left superior rectus, and option D is left inferior rectus. Before knowing the correct answer, let's know what is yoke muscle is. Yoke muscles, also known as the contralateral synergist. It refers to the pair of muscles from each eye which contracts simultaneously during the version movements. For example, right lateral rectus and the left medial rectus are the yoke muscles. So, the correct answer here is left inferior oblique. Question number 22. The capsulopalpebral fascia of the lower eyelid is analogous to option A, levator palpebrae superioris, option B, muscle of Riolan, option C is superior orbital septum, and option D is orbicularis muscle of the upper eyelid. So the correct answer here is levator palpebrae superioris. Is the capsulopalpebral fascia in the lower eyelid helps in the lower eyelid retraction with the help of inferior tarsus. Similarly, in the upper eyelid, the levator palpebrae superioris epiloidosis along with the molar muscles help in upper eyelid retraction. Hence, the levator palpebrae superioris is analogous to the capsulopalpebral fascia of the lower eyelid. Next question. Question number 23. Isolated third knob palsy with pupil sparing is seen in option A, aneurysmal rupture, option B, trauma, option C, diabetes, and option D is raised intracranial pressure. So the correct answer here is diabetes mellitus. An interesting point to note is that before the third knob reaches the orbit, the fibers innervating the pupillary muscles, that is pupillomotor fibers, are located superficially in the knob trunk. The pile blood vessels supply these fibers. In contrast, the main trunk of the fibers is supplied by the vasa nervosum. Lesions such as aneurysm, uncal herniation, or tumor which compresses the knob from the outside will involve the superficial pupillomotor fibers and their blood supply. On the other hand, medical lesions such as diabetes mellitus or hypertension associated microangiopathy will affect the vasa nervosum and thus spare the pupillary fibers, and thus this results in pupil sparing third knob palsy. Here in this picture you can see the aneurysm compressing the knob from the outside, which involve the pupillomotor fibers, whereas in vascular conditions which involve the vasa nervosum, this leads to the infraction of the central nerve fibers, and thus this does not involve the pupillomotor fiber, thus sparing the pupil. Next question. Question number 24. Jack in the box phenomenon is seen in correction of option A, myopia, option B, regular astigmatism, option C, irregular astigmatism, and option D is aphakia. So the correct answer here is aphakia. This condition arises in aphakia when spectacles are used for the correction of the vision. Convex lens is used in the spectacles. The edge of the convex lens acts as a prism, and the higher the power of convex lens, the greater is the prism angle. That is this alpha angle here. The light falling on the prism bends towards its base by making an angle of alpha by 2. Here you can see. Therefore, greater the angle alpha, the more will be the bending. In aphakic spectacles, the angle alpha being large, the light falling on the edge of the lens bends towards the center of the lens, that is the base of the prism. Here you can see the light falling on the peripheral part of the lens, which acts as a prism that it bends towards the center of the lens, and thus it does not reach the pupil and is therefore not seen. This results in an area of visual field which is not visible to the patient, that is the scotoma. And because the edge of the lens is present all around the lens like a ring, so it gives rise to a ring-shaped scotoma. The position of this scotoma is not fixed in the visual field because the eye keeps moving or roving in relation to the ophthalmic spectacles, hence result in roving ring scotoma. The presence of the roving ring scotoma leads to another interesting phenomenon. If an interesting object appears in the periphery of the patient's visual field, it appears blurred because the light is passing from the side of the spectacle front. The person tends to move his head towards the object in order to see it clearly, but as he turns the head, the object comes to lie in the area of scotoma and thus disappears. As he turns the head further so that the object comes to lie in front of the spectacle in the visual area, and so it reappears again clear and sharp. This sudden disappearance and sharp reappearance of object is called jack-in-the-box phenomenon.